Hi, Dr. Huffman. I'm just going to show you my sheet before I get started. Okay. Good morning.
Hi.
How are you doing today?
I'm good. How are you?
Good, thank you. My name is Natalie, and I'm going to be your student nurse today.
Okay.
Could you tell me your name and date of birth, please?
Erin Segerstrom, 52702.
Okay. And do you have any allergies?
Nope, none that I know of.
Okay. So today, Erin, we're just going to be doing a head-to-toe assessment on you, okay?
Mm-hmm.
And so basically, I'm just going to take a look at some of your body systems and just make sure that they're working okay and working together.
Okay.
But before we get started, I'm just going to ask you a couple questions, okay? Could you tell me what year it is?
It is 2022.
Okay, and what state are we currently in?
We are in Michigan.
Okay, awesome. So by asking those, I can declare that you're alert and oriented ×3. So I'm able to continue the assessment. Could you tell me, are you on any medications, Erin?
No, I'm not. I just take multivitamin.
Okay, and is that the only over-the-counter or herbal supplement you take?
Yep.
Okay, awesome. Have you had any previous surgeries?
No.
Okay, and do you have any personal diagnoses, or do you have any family members that have been diagnosed with something?
Nope, not me or my family.
Okay, awesome. So a couple personal questions for you. How often would you say you drink?
I don't really drink at all.
Okay, and how often would you say you smoke?
I don't smoke at all either.
Okay, and what about vaping?
Nope.
Okay, and do you partake in any recreational or street drugs?
Nope.
Okay, so I think those are all the questions I have for you. So we're gonna get started on your head-to-toe assessment if that's okay.
Okay.
Okay, so I'm just gonna stand up. I'm gonna start with your hands, okay?
Okay.
So I'm just gonna take a peek. I'm looking for clubbing, which would just mean poor oxygenation to your fingers, and I don't see any. You have really nice long nails.
Thank you.
I'm gonna do a capillary refill on you, and it's less than 3 seconds, which is normal, and that means you have good perfusion to your extremities. As I'm taking a look at your skin, Erin, I don't see anything abnormal. I just see a couple moles, but nothing that is out of the ordinary. Again, same on this side. It looks good. Maybe a little bumps right here. Is that normal for you?
Yeah, I have keratosis pilaris. It runs in my family.
Oh, okay. So that looks good. I'm just gonna do a little squeeze up the arm to make sure you have even muscle tone. And again, that is all looking really good, okay? So I'm just gonna get some vital signs on you real quick if that's all right.
Yep.
Okay, I'm gonna start with blood pressure. Do you have a preferred arm?
No, it doesn't matter.
Okay, awesome. I'll just do this one and roll this up for you. Does that feel okay?
Yeah, that feels good.
Okay. I'm just gonna clip this on. Okay. So it's just gonna get a little bit tight, okay?
Okay.
And my diaphragm is on. Okay. Okay, so your blood pressure was 110/72, which is normal. So that is awesome. Is that normal for you?
Yeah, that is.
Okay, awesome. So the next vital sign I'm going to do on you is your pulse, okay?
Okay.
So I'm just going to snag a wrist from you. I'm just going to push these up, okay? I'm just going to, you can just rest it right here, okay? Okay, and so your pulse was 72 today, which is normal. The range we want to see is between about 60 and 100, so
Okay.
that's really good. I'm going to actually come around to the other side and just feel this pulse too, okay?
Okay.
Okay, 1 hour scale on those. I also got your respirations, and those were 18, and the normal range we want to see for those are 12 to 20, so again, that is also normal.
Great.
So today I don't have an SpO2 to just check your pulse ox with me, but if I were to do that, I would just clip that on your finger, and because you said you don't have any respiratory issues, I would expect to see about 97 to 100%.
Okay.
And also, I do not have a thermometer with me, but I could take your temperature in your ear, underneath your tongue, or even on your forehead, and I would expect a temperature around 98.6 degrees.
Okay.
Okay, so those are all your vital signs that I have. So the next thing we're gonna do is some range of motion, okay? So for range of motion, the first thing we're gonna do is I wanna see some flexion and extension, okay? Good, and is there any pain with that in your elbows?
No.
Okay. The next one I'm gonna have you do is called pronation and supination, which was gonna go like that. Good, and any pain with that?
No.
Okay. So if you could just put your wrist in a circle for me, good. And the next thing we're gonna do is we're gonna check for some crepitus, which is just some cracking in your shoulders. So have you ever been swimming before?
Yep.
Okay, so I'm just gonna put my hand on your shoulder. I want you to give me one good front stroke and then one good back stroke, okay? It's gonna go like this. Good, and I didn't feel any cracking, which is good. And we're gonna do the same thing on this side, okay? I'll go right here. Good. And no pain with that?
Nope.
Okay. So again, I'm gonna do the same thing for your feet. Oh, I mean for your knees. If you could just extend your knees out. Good. And for this one, with a little pop, but is that painful when that happens?
Nope, not at all.
Good. So I checked for crepitus, which is good. And so the next thing we're gonna do is some strength tests, okay? So what I'm gonna have you do is put your hands out kind of like a karate chop. Good. And I'm gonna have you push out against my hands, okay? Good. And then we're gonna do the opposite, push in, good. And then go like this, like we're doing patty cake, good. And push up, and then push down, good. And your muscle tone seems even in both, which is good. And now we're gonna do the same thing for the feet, okay? So I'm gonna come underneath, and I want you to push down on my hands, good. And then I want you to push up, and then I want you to push out, good. And then we're gonna push in on me, okay? Good. And again, those legs seem nice and strong, and both of them seem even. If you want to give my hands a quick squeeze, good. And then while I'm here, I'm just going to do a patellar reflex, okay? So I'm just going to lightly hit your knee, and I'm going to expect your leg to kind of come out, okay? Just going to lift this up so I can see better. And I'm going to go right here, okay? Can the camera see okay? You ready?
Yep.
Okay. Well, I'm going to go a little bit lower. I'll try right here, okay? There we go, it went a little bit, and then I'll come on this side, and I'll do it again. Good, and I saw that. So your patellar reflex is working well after my third try. So after taking a peek at your arms and hands, everything's looking good, okay? So I'm gonna work my way up your body, and I'm gonna start on your neck, so I'm gonna take a listen and feel for those carotid arteries, okay?
Okay.
So I'm first gonna take a listen. And I'm gonna listen for something called a bruit, which is basically like a whooshing sound.
Mm-hmm.
And that could be an indication of an aneurysm or some sort of plaque buildup, and we don't wanna hear anything. So because of that, I'm gonna use my bell. So I'm listening for a bruit. And I'm just gonna have you turn away, okay? And when I put it on your carotid artery, I just want you to hold your breath. Okay, I didn't hear anything, which is good. Just gonna come around to the other side and do the same thing, okay? Good, and again, I didn't hear anything. So now that I listened to those, I know it's safe to touch them, and I'm just gonna touch each of your carotid arteries one at a time.
Mm-hmm.
I'm gonna start on this side and just feel for it. Good, and on this side. Good, and when I felt both of those pulses, they both seem symmetrical. And they're both really good pulses, so I'm gonna, again, just feel your radial pulses, and they're both symmetrical. I rate them a 2 on our scale, which is normal. I'm gonna go up to your brachial pulses, and again, I would rate those a 2 as well. Those are normal. So now we're gonna go up to your head, and we're gonna do some cranial nerve assessment, okay?
Okay.
So basically, your cranial nerves are these pairs of nerves in your body that help your body do really important functions, okay? So for the first cranial nerve, it's cranial nerve 1, which is your olfactory cranial nerve. And basically this cranial nerve is just all about smells, okay? So I'm gonna have you close your eyes and I'm gonna get a smell for you. It doesn't smell bad, and I just want you to identify it for me, okay?
Okay.
Whenever you're ready, just take a sniff.
That smells like mint.
Yes, it's Mentos gum. Good job. So that was testing your first cranial nerve. The next cranial nerves I'm going to test are 3, 4, and 6, which are your ocular motor, your trochlear, and your abducens. And basically, these cranial nerves are all about your eye movements and how your eyes are working, okay?
Okay.
So for the first test, I'm going to have you do is I'm just going to have you look right at me, okay? And I'm just going to shine a light very quickly in each of those eyes. Good. Good. And when I did that, both of your eyes did constrict, which is good because when there's light, you don't want them to be dilating. So that was testing your ocular motor, cranial nerve. So the next part of the eye test is I'm going to have you do the 6 fields of gaze for your cardinal views. So basically what this means is I'm just going to have you take a look at my pen light and I'm going to move it in 6 different directions and I just want you to follow it with just your eyes, okay?
Okay.
Good. And there was any pain with that? Did that feel okay?
Yep, that felt good.
Okay, awesome. So another eye test we have to do, there's kind of a lot of them, is something called accommodation. So basically what I'm going to have you do is I'm going to have you take a peek at my pen light, okay? And once you're staring at that for a couple seconds, I want you to take a look at the back wall, and then back at my pen light, and then back at the wall. Good. And when you did this, your pupils were dilating when you were looking farther away, which is normal. So after that assessment, I can determine your eyes are perla, which means your pupils are round, they're equal, they are reactive to light, and they also accommodate to different directions or how far stuff is away. So that's all really normal, which is good.
Great.
So there is one more test to do with the pen light, but it's not going to be in your eyes, I promise. So this next portion of the test is just to test your cerebellar function. So what I'm going to have you do is I want you to put your finger on your nose. Then I want you to come out and touch the pen light and then back to your nose. And then again, back to your nose. Then one more time, back to your nose. Good. And there's 2 more of these kind of tests we're going to have to do today, okay? So you give me a big okay sign and then switch fingers. And then as you do that, just keep speeding up. Good. And the last one is we're going to play patty cake with our legs. We're going to flip them over, then back, and then speed up as you go. Good. So those 3 tests were to test your cerebellar function, and that all seems really normal and intact.
Great.
So we've done 1, 3, 4, and 6 for your cranial nerves. The next one is your 5th cranial nerve, which is your trigeminal. And basically, this is the cranial nerve of mastication, which is just chewing. So I'm just going to take a feel to your jaw. Good. It's nice and clenched, and it feels strong. Is there any pain with that?
Nope.
Do you have any trouble eating or swallowing?
No.
Okay. So the second part of this test is to also test your facial senses. So I'm just going to have you close your eyes, okay? And then I'm just going to touch somewhere on your face, and I just want you to identify where I'm touching.
Okay. My forehead,
Good.
my chin, my left cheek, my nose, my right cheek.
Good. And you were able to identify all of those, which means your trigeminal nerve is intact. So the next nerve we're going to test is your 7th cranial nerve, which is your facial nerve. So I'm going to have you make some silly faces at me. Okay, could you smile really, really big? And then get really, really angry at me. And then puff your cheeks out. Then give me a little frown. Okay, so those faces were all normal and nothing seemed out of place when you did that. Your 8th cranial nerve is your auditory and also helps with your balance. So I was able to hear me today, and later when we get you stood up, we'll be able to test that as well.
Okay.
So for your 9th and 10th cranial nerves, these are your hypoglossal and your vagus. And basically these 2 cranial nerves help, when you open your mouth, it helps move your uvula up. So I'm just gonna grab my tongue depressor, which today is going to be a spoon. So basically before I use it, I'm just gonna take a peek in your mouth, okay?
Okay.
You just open up for me. Good. I see your hard and soft palate are intact. Your gums look nice and pink. Have you ever had cavities?
Yeah, I've had 2.
Okay, and they've been filled
Yep.
and no problems with that?
No.
Okay, good. Are you having any pain in your mouth today?
No.
Okay, awesome. So, do you have a bad gag reflex?
A little bit.
Okay, so I'll make sure just to stay towards the front of your mouth.
Mm-hmm.
So I'm just gonna use the end of the spoon to push down your tongue, and I'm just gonna have you say ah for me, okay?
Okay.
Good. So by doing that, I was able to see that uvula move up, which means that your 9th and 10th cranial nerves are working. And I also took a peek and I saw your tonsils in there, and I don't see them inflamed or swollen, which is also really good.
Good.
So I'm just gonna put this aside. And so for your 11th cranial nerve is called your spinal accessory. And basically this just tests the muscles in your shoulders. So if you could just do some shredding for me. Good. And does that feel okay?
Yep.
Okay, and it feels symmetrical. Your 12th cranial nerve is your hypoglossal. And this is essentially all movements of the tongue. So if you just stick your tongue out for me and then kind of swirl it around, good. And that seems to be working just fine. So we tested all the cranial nerves, and now I'm just gonna feel for some lymph nodes, okay?
Okay.
And these are just little balls beneath the skin that if you get an infection, they kind of get irritated and inflamed. So if you could take your hair down for me, I'm just gonna take a peek at your hair first, and then I'll start feeling behind your head, okay?
Okay.
So I'm looking at your hair, and it looks evenly distributed. It's nice and thick.
Yeah, I do have thick hair.
Yeah, it's a nice color. Have you ever dyed your hair before?
Nope.
Okay. I don't see any abnormal lesions on your hair, which is good. I don't see any patchiness, and your scalp doesn't seem dry. So if you want to put your hair back up, you can go for it. And while we're looking at the face, your skin looks really clear. It's a nice pink, it's a flush color. I don't see any acne. I see a couple freckles.
Mm-hmm.
And do you have any history of skin cancer in your family?
My grandpa had skin cancer, but I think that's just from his sun exposure.
Okay, and when you're in the sun, do you normally wear sunscreen?
Yes.
Okay, good. So I'm just gonna take a feel for those lymph nodes now, okay? So I'm gonna start in the back. I'm gonna start with your occipital. And if there's any pain with these, you just let me know.
Okay.
Your post-auricular, your pre-auricular, your submandibular, your submental, and then your cervical chain. And then I'm gonna reach down here a little bit, okay? You can bring, perfect. I'm feeling for your supraclavicular, and while I'm here, you can relax. Just gonna do a skin trigger test, which is just checking your hydration status. And because your skin falls back down really quickly, that means you're well hydrated.
Great.
Okay. So I felt your lymph nodes. I'm just gonna take a feel for your sinuses, okay? So I'm just gonna give you a little head massage. And these can be tender sometimes, so if it is painful, just make sure to let me know. Was there any pain with that?
Nope, not at all.
Okay, awesome. So now I'm gonna move over to the ears, okay? I'm just gonna come to the side, and while I'm looking, your pin is a nice color. I don't see any discharge in your ear. I do see you have a couple ear piercings.
I do.
Have you had any trouble with those?
Nope.
Okay, good. Just gonna come around to the other side. And again, do the same thing. Your pin is a nice color. I don't see any discharge. It doesn't look red or irritated. And no problem with these ones over here?
Nope.
Good. So the last part of the facial examination, we're gonna take a peek in your nose, okay? This part's not really fun, but I'm gonna have you lean back. I'm gonna give you a little bit of a piggy nose, and I'm just gonna take a look, okay? Okay, so when I'm looking in there, it looks nice and pink and really moist. I don't see any bleeding or any signs of drainage or anything like that. And so that all looks really good.
Great.
Okay. So now that we did that, I'm just gonna go check my sheet and make sure I didn't forget anything, and then I'm gonna head over to the back, okay?
Okay.
Okay. So now I'm gonna move into the back, so I'm actually gonna move the camera. Let's see if we can get it set up in a good place. Okay. And I'll check on it once in a while, make sure it didn't fall, okay? So we're just gonna have you scooch over a little bit this way just so the camera can see, okay?
I'm sitting on my gown. There we go.
Is that comfortable for you? Just
Yeah.
stand up nice and tall, okay? Okay, so while I'm back here, I'm just gonna check her tracheal alignment. And that seems even to me, which is good. And now I'm gonna palpate your thyroid, which is basically this gland right in front. So in order to do that, I'm just gonna push your trachea over to the side, and then I'm gonna feel on that side I'm pushing towards, okay?
Okay.
And then to the other side. And when I did that, your thyroid was non-palpable, which is okay. We don't normally want to be able to feel that thyroid gland, but if we were, as long as it wasn't painful, it would be nothing to worry about, okay?
Okay.
So the next part of the assessment is going to take a listen and feel to those lungs, okay? So is it okay if I untie your gown?
Yep, that's okay.
I'll tie it back up once we're done. Maybe a little chilly in here. I see you have a nice tan line right here.
I do. I went to Florida
Oh, really? How
Yeah.
recent was that?
a few weeks ago.
Nice. So taking a look at your skin, Erin, I see a couple places of irritation and some moles, but nothing out of the ordinary. And again, you have that tan line, but nothing to be concerned about. Okay, so I'm first gonna take a listen to your lungs, okay?
Okay.
So there's 12 places I need to listen to, and I'm gonna place my stethoscope on one. I'll have you take a big deep breath, and then when you feel my stethoscope move to another place, just take another big deep breath for me, okay?
Okay.
And if you're feeling tired or getting lightheaded from doing this, just make sure to let me know.
Okay.
Okay. So before I do that, I'm actually gonna feel where your lungs end. I just wanna make sure I'm getting all the way to the bottom of the lungs, okay?
Okay.
So if you could take a big deep breath in for me. Good, and just one more. Good, so I can see that your lungs end about right here, okay? Which is normal, it's nothing crazy. I'm gonna feel for your A and P diameter, so I'm just gonna reach around the front, feel your breastbone, and then compare it to the side, and your A and P diameter is 2 to 1, which is normal. If we were to see 1 to 1, we'd be worried about barrel-chested people, which means they have a lot of air they can't get out of their lungs, but you don't seem to have that, okay?
Okay, great.
So I'm just gonna take a listen now. I'll try to warm up my stethoscope, it's kind of chilly. And I'm switching over to my diaphragm. And if you could just retract your scapulas just for a sec, I want to see where they end. If you could bring them back towards me, perfect. Okay, you can relax now, okay? Here's the first spot, big deep breath in and out. Okay, spot 2 again. Good. Spot 3. Spot 4. Spot 5. Spot 6. And I'm just gonna lift this up, okay?
Okay.
Here's another spot. Spot 7. Good. I'm gonna lift it up over here now. Spot 8. Good. Spot 9. Spot 10. Spot 11. And spot 12. Good. So while taking a listen to your lungs, they are bilaterally clear, which means I didn't hear any crackling in your lungs, which if you were to have that, that could indicate maybe you have some fluid that's in there, but I didn't hear that with you, so that's awesome.
Okay, great.
So in those same 12 spots I just listened to, I'm also going to percuss, which is just a light tapping on your back. And this is just to determine how your lungs are, like how they sound when you tap them instead of rather than listening. And when I do this, I should hear a resonant sound from you, okay?
Okay.
I'm just gonna feel this light tapping, and if this is painful at all, just let me know, okay?
Okay.
That's spot 1. That's spot 2. Spot 3. Spot 4. Spot 5. 6. I'm just gonna come under here, okay?
Okay.
Spot 7. Spot 8. Spot 9. Spot 10. That's 11, and then one more. That's 12. And when I did that, I could hear all sounds of resonance, which is normal, okay? So the next part of the assessment is we're gonna actually have you lie down, okay?
Okay.
So I'm gonna untie the back of this just so you don't get stuck underneath it.
Okay.
And then I'm gonna help you lie down, okay? And we're gonna lie you down flat first, and then I'll get you a pillow to prop you up,
Okay.
okay? I'm gonna grab the camera so you can hold it for me, that's okay?
Yep. I'm gonna get under the covers.
Oh yeah, thank you. Here, I can help you with that.
Thank you.
Good. Okay. Is that warm enough for you? It's kind of
Yeah.
chilly in here.
Yeah, that's good.
Okay, and if I could just have you lie flat for me just for a second, okay? I'm gonna grab the camera. Okay. You can hold that for me whatever way is comfortable. Okay, so for the first thing I'm assessing for while you're lying flat is JVD, which is jugular vein distension. So I'm just gonna have you turn to one side, okay? And I'm looking at your height, and I don't see anything. And I'm gonna come to the other side, and if you could turn the other way. And again, I don't see any, so that's good. We would be worried if we saw that, so that all looks good.
Okay.
Do you want a pillow? Would that be more comfortable for you, or are you okay?
I'm okay. Thank
Okay.
you, though.
Yeah, of course. So for the next part of the assessment, we're gonna take a listen to your heart sounds, okay? These are obviously super important. So I'm gonna have to expose your chest a little bit. Is that okay if I pull down your gown?
Yeah, that's okay.
Okay. I'll try to keep you as covered as possible though. I can tuck this in for you. Okay. Ooh, sorry. Okay, so for the first part of the assessment, I'm just gonna take a listen to some different valves, okay? So I'm first gonna auscultate, and I'm going to listen with my diaphragm, and I'm gonna take a listen to the aortic pulse, or to the aortic valve, and that's gonna be 2 intercostal spaces below your clavicle.
Okay.
On your right side. So I'm gonna start at your clavicle, and I'm gonna count 1 intercostal space and 2 intercostal spaces, and it's gonna be kind of close to the middle of your chest, and I'm just gonna take a listen for a couple beats, okay?
Okay.
Good. And I heard those beats nice and strong, and I'm holding my place, and I'm gonna turn it over to the bell where I'm gonna listen for heart murmurs. And again, I did not hear that whooshing, so that's nothing to be concerned about. And now we're gonna listen to your pulmonic valve, which is gonna be the same location, just on the opposite side.
Okay.
So I'm gonna count down from your clavicle. I'm gonna go 1 intercostal space and 2 intercostal space. And I'm gonna switch back to my diaphragm and take a listen to that valve, okay? Good, and I hear that heartbeat nice and strong. And we're gonna switch over to my bell while I save my spot and listen for those murmurs. Good. So that was your second intercostal space. So we're gonna move down 1 more to something that's called your Erb's point. And here I should be able to hear your heartbeat the loudest.
Okay.
So we're gonna switch back over to my diaphragm to listen to that. Which I hear that nice and loud. I'm gonna save my spot and switch over to my bell. And again, I don't hear any whooshing. So now, Erin, if you don't mind, I'm just gonna sneak up from underneath your gown, and so I can find the next point I'm gonna listen to.
Okay.
Okay, I'm just gonna save this spot with my finger. And I'm gonna pull up your gown. Sorry, I know it's kind of cold. Okay. So I'm gonna pull up your gown, Erin, and I'm just gonna meet my fingers, and I'm gonna go down 1, there we go. 1 more intercostal space, so this is at 3, and we're gonna go down to the 4th, which is right here, And I'm gonna have to kind of move your bra a little bit, okay?
Okay.
And if you're able to help or you wanna hold your breast for me, that's fine too. I'm actually gonna come up underneath your bra if that's okay. Okay, it's gonna be right here for me, okay? So again, I'm switching to my diaphragm. Thank you. Okay, and here I'm listening to your tricuspid valve, and I just listened and I can hear a good heartbeat, and we're gonna switch over to listen for murmurs. Which I don't hear anything. So now this is your fourth intercostal space. We're gonna go to your fifth, and we're gonna be mid-clavicular, and this is your mitral valve, okay? So I'm gonna take a listen first to hear if I can hear it at all, and then I'm gonna listen for bruits, and then I'm gonna take your pulse here too.
Okay.
I'm just gonna take a quick listen with my diaphragm, which I hear very well, and then we're gonna switch over to my bell, take a quick listen for a murmur. I don't hear anything. So while I'm here, Erin, I'm just gonna take the apical pulse for a full minute, okay?
Okay.
Are your arms doing okay?
Yeah, my arms are good.
Okay. Okay, and when I listened there, I got a pulse of 76, which again is in that normal range. We want to see between 60 and 100.
Okay.
So I'm all done with your cardiac assessment. So now we're gonna move down to your GI, okay? So I can pull this down for you. And then if you don't mind, I'm just gonna pull your pants down just a little bit further.
Yep.
Okay. Just so it can expose that abdomen. Is that okay for you?
Yep, that's good.
Okay. So before I start my GI assessment, I'm just going to take a look. So I'm gonna get to your level, and I'm gonna take a peek at your abdomen. And while I'm looking, it looks like your contour is nice and flat. I don't see any abnormal lesions, and your skin color here is also nice and a good flush color. I do see some moles. Do you see a dermatologist at all?
Yeah, I do.
Okay, so this one's a little bit of a funky shape, but I'm assuming they're keeping an eye on it if you go there
Yep.
regularly.
Yeah,
Okay,
they
good.
are.
So after inspecting, I've deemed it safe to be able to take a peek. And while I'm also looking, I can see your aorta pulsating, which is also normal. So after inspecting, I'm just gonna take a listen, okay? So I'm first gonna take a listen to what are called your bowel sounds, which are just like those gurgling sounds that you hear in your belly. I'm gonna start in your right lower quadrant, and I'm gonna take a listen for about 5 gurgles, okay? So I'm gonna have it on my diaphragm, and I'm starting in the right lower quadrant. Okay, and I heard about 5 gurgles, so we're gonna move up to the right upper quadrant. Good, okay, we're gonna move over to the left upper quadrant. And then we're gonna move down to the left lower quadrant and listen for 5 gurgles. Good, and I heard 5 in there also. So I was able to hear movement in all 4 quadrants, which means that I can hear and everything. So that means your tract is moving really, really well. And if you don't mind me asking, when was your last bowel movement?
This morning.
Good, okay. And that was normal. Is that normal for you?
Yep.
Okay, awesome. So I took a listen to your quadrant, so now I'm gonna take another listen, but this time I'm gonna listen for your arteries, okay?
Okay.
So weirdly enough, you do have arteries in your abdomen. So as I mentioned, you have your aorta, and there's gonna be a couple other places that I listen to, okay? And so for this one, I'm going to listen with my bell because I'm listening again for those bruits, which are like that whooshing sound.
Okay.
So I'm gonna start at your aorta, which is right here. Which I don't hear anything, so we're gonna move down to your right renal artery. Which again, I hear nothing, so we're gonna move to your left renal artery. And then we're gonna move down to your right iliac artery. And then we're gonna go to your left iliac artery. Good. And this next artery we have to listen to is kind of close, it's kind of in your groin, okay? So I'm gonna pull this down and I'm gonna expose your legs and then I'm gonna go up to feel your pulse. And then once I find it, I'm gonna take a listen, okay?
Okay.
I'll try not to get too close. And if you're ticklish, I do apologize. So first, I'm gonna take a feel for those arteries and I can feel them both and I would consider them a 3, which are bounding, but that's okay because these are some pretty big arteries. I'm gonna first take a feel for this one. Again, I'm using my bell to listen for those bruits. So I'm gonna find it first and then I'm gonna take a listen. Which I don't hear anything. And I'm gonna find this one again and take a listen. Good. And I didn't hear any bruits in those, so that's really good. So now we're gonna move back up to your abdomen because now I know that it's safe to touch because I was able to listen and I didn't hear anything abnormal. I'm just gonna pull this back up again. And the next thing we're gonna do is called percussion. So again, I'm gonna do that kind of that tapping sound on your belly, and I'm gonna wanna hear a sound called timpani, which is like this really, really hollow sound, okay?
Okay.
So I'm gonna start in the right lower quadrant. I'm gonna percuss in 3 different places in every quadrant. I'm just gonna pull these out just a little bit more. Thank you. Okay. Good. We're gonna go up to your right upper quadrant. Good. We're gonna go to your left upper. And then down to your left lower. Good. Was there any pain with that?
Nope.
Okay, good. So I was able to hear timpani in all 4. So the next type of percussion we're gonna do is the same thing, but instead of going around, I'm gonna go up, and I'm gonna start in your right lower quadrant and go up until I hear your liver, which is gonna be kind of more of a dull sound, so you'll be able to hear the sound difference, okay?
Okay.
Okay, so I was able to hear that liver, which sits about 1 centimeter below your rib cage. So that is also normal. So after doing some percussion, I'm going to do something called palpating. There's a lot to do for the abdomen. So palpating is just going to be, the first time around, is going to be a nice little gentle touch, and then there's going to be a deeper touch the second time, okay? Is there any places you want me to avoid that are kind of painful right now?
No, that's okay.
Okay. So I'm going to start in the right lower quadrant and do some light palpating, and I'm going to go up to the right upper quadrant and kind of follow the way your food goes. And go to your left upper quadrant, and then down to your lower left. And that felt okay?
Yep.
Okay. So now I'm gonna do that deep palpation I was talking about earlier. Just gonna push a little bit deeper, just to feel some, for any abnormal masses. Again, I started in that right lower quadrant, worked my way up to the right upper, over to the left upper quadrant, and then to the left lower quadrant. Okay, good. And I didn't feel anything hard underneath, and you said it wasn't painful.
Nope.
So that's awesome. So I'm done with the abdominal assessment. So the next part of the assessment is going to be your legs, okay?
Okay.
So I can take this back for you if you'd like. And we are gonna put it back over here, up top where we started. Okay. So for the next part of the assessment, I'm just gonna move this. I'm just gonna pull this up so I can see your legs, okay?
Okay.
But I'll keep you as covered as I can. So while I'm here, I'm noting, Erin, your skin tone is nice and flush. I don't see any, I see a couple scars right here.
Yeah.
Do you know those are from?
Yeah, I was swimming in a lake and I hit a zebra mussel and it cut my knee open.
Oh my gosh.
Yeah.
I'm glad you're okay. That sounds terrible. I see you have a birthmark right here. Have you had that your whole life?
Yeah, I have.
Okay. And everything else looks normal to me. When I press on your calves or by your tibia, I don't see any pitting, which just means you could have some swelling, and I don't see that with you. I'm gonna reach underneath your knees and just feel for some pulses. These are your popliteal pulses. And I can feel them. I'd rate them about a 2, which is normal. And then, do you mind if I pop those socks off?
Yeah, go ahead.
Okay. I'll go nice and fast just in case you're ticklish. So again, I'm gonna feel for some more pulses. I'm gonna do your posterior tibialis, which again I feel. I rate them about a 2. They're a little bit weaker, but it's okay because they're just farther from the body. And then the last pulse I'm gonna feel is your dorsalis pedis. And I would rate this about a 1 because it's a little bit weaker, but again, it's just because it's so far from the body or from the heart. While I'm here, I'm just gonna do a capillary refill on your toes. And it is less than 3 seconds, which is good. Your feet do feel a little bit chilly and maybe a little clammy, but nothing to be concerned about.
That's normal for me.
It is? Okay, good. So I did those pulses and I did your cap refill. So I can put those socks back. Actually, I can't do that quick. Yeah, I'm gonna do one more test on you, okay? So this next test we're gonna do is called the dull and sharp point test. And basically, I'm just gonna, when we're ready, I'm gonna have you close your eyes and I'm gonna either touch you with a dull touch or a sharp touch. Can you feel the difference?
Yes.
Okay. And I'm just gonna have you identify what type of touch it was as well as where it was on your body, okay?
Okay.
You can just close those eyes for me.
That is dull and that is my right thigh.
Good.
Sharp, my left calf.
Good.
That is dull and that's my right calf.
Good.
That's dull and that's my left thigh.
Good.
Dull, the bottom of my right foot. Sharp, the top of my left foot.
Good.
Dull, the top of my right foot. Dull, the bottom of my left foot.
Okay. And you're able to feel all those points, which is really good. So I would give you an 8 out of 8 on those different touches I did. So now that I did that, I am able to put your socks back on for you. And we're almost done with this assessment, okay?
Okay.
I know it's kind of extensive, but you've been awesome. Good. So the next portion of the assessment, we're gonna have you actually get up, okay? Are you feeling dizzy at all right now?
No.
Okay. So let me just cover you back up and I'll help you sit back up. And then once you're up, I'll tie that gown for you, okay?
Okay.
So if you're able to sit up for me, let me just tie this for you so you don't walk around without your back covered. Let me just grab that. Good. And you can keep that hair down if that's easier for you, whatever's comfortable.
Well, I'll put it back up.
Okay. Okay. So I'm gonna have you swing around, okay? But don't get up quite yet. I just want you to sit here for a couple seconds. Okay. And are you feeling okay?
Yep.
Okay.
Feeling good.
Feeling dizzy at all?
No.
Okay, so we're gonna get these shoes on before we have you get up, okay?
Okay.
There you go. They're a little tricky, aren't they?
Yeah, they're tight.
That's good though.
Yeah,
You want them to be safe.
Yeah, they keep them on my feet.
Okay, so for the first part of this assessment, Erin, I'm just gonna have you stand up whenever you're ready, and we're just gonna stand here, and you're gonna have your eyes closed, and I'm just gonna see how well you can balance. Okay?
Okay.
Whenever you're ready. Just close those eyes for me. Okay, and you can open those. So that was called the Romberg test, and basically that just shows how well you're able to not sway. So I would give you a negative Romberg, which is good.
Okay, good.
So by doing that, I can deem you safe to walk. and you are wearing your shoes. So for the first part of this test, Erin, we're just gonna walk kind of towards the camera, just a normal pace, and then on the way back, we're gonna do heel to toe, okay?
Okay.
Whenever you're ready. Good. Awesome. So if you could just sit back down for me, that's all the walking I had to do for you today. So that pretty much completes the most of your head to toe assessment. There's one more thing I have to do, which is called the Braden scale. So basically the Braden scale is a scale that we use to determine the risk of pressure ulcers.
Okay.
And so today, by assessing you head to toe, I'm not concerned about pressure ulcers for you because when we talked about, when we did the little test on your legs to be able to feel if they were sharp or dull, you didn't have any problems. And I didn't ask about your mobility yet, but I was getting to that. So how often would you say you exercise, or if you exercise at all?
I exercise a few times a week.
Okay, and what does that look like to you?
I do body weight exercises usually.
Oh, awesome. Okay, so one of the things we look for in the Braden scale is activity and mobility. And by you telling me that, I know that you're getting off and you're active every single day. Another part of the Braden scale is your nutrition. So what would like a day consist of for you for like meals?
I eat a lot of pasta. I really
Okay.
like pasta. And I like bread, so a lot of carbs I eat. I could eat more vegetables and fruits, but
Okay, but that's
I'm
okay.
getting enough food.
Good, because even though you are having those carbs, as long as you're working out, you're not overly excessively eating those carbs, then it shouldn't be a problem, but getting those veggies and fruits in is still really important.
Mm-hmm.
So by hearing how you are eating, nutrition is something we look at for the Braden scale, and I'm not worried about your nutritional status. Because you are moving, I'm not worried about friction and shear, which just kind of means your skin is sliding on itself.
Mm-hmm.
I'm also not worried about excessive moisture, because when I was feeling your legs and arms, you weren't wet or sweating too much. So by that, I would give you a 23 on the Braden scale, which basically is a perfect score on the Braden scale, and essentially all that means is I'm not worried at all for your risk of pressure ulcers. And yeah, do you have any questions for me, Erin?
No, thank you.
Of course, it was so nice meeting you, and I appreciate you letting me do my head to toe assessment on you.
Thank you.
You're welcome. I'm just gonna get some hand sanitizer, and I'll get out of your hair, okay?
All right, thank you.
Mm-hmm.